Cervical cancer is the most common cancers in females in India, and if detected early, it is curable cancer. Hello, I am Dr. Shefali Sardana. I am Principal Consultant Medical Oncology at Max Saket. When we deal with cervical cancer, there are certain questions which come up into the minds of patients, like what is cervical cancer, what are its important causes. Basically, cervical cancer is the cancer of cervix, which is the opening or mouth of the uterus, which exists in the lower part of the uterus. And one of the important causes for cervical cancer is infection. That is the HPV virus infection. The human papilloma virus is most important cause, and various types of HPV virus infection constitute 70% of cervical cancer cases. Apart for HPV virus infection, there are other causes also, like obesity. If somebody has a family history of malignancy, gynecological malignancy, or somebody has history of multiple pregnancies, these patients are prone to have cervical cancers. What are the stages of cervical cancer? So basically, cervical cancer has 4 stages. Stage 1 is basically very early stage, confined to cervix. So lesion may or may not be palpable in this stage, and the symptoms can be intermenstrual bleeding, bleeding after the intercourse, or abnormal frequent foul smelling discharges per vaginum. Then we have stage 2 cervical cancer, where still the cancer is limited to cervix. However, the lesion is large and it is basically palpable on per vaginal examination. If we see stage 3, it is basically involving the nearby structures to cervix, that is parametrium and vagina. And stage 4 includes stage 4A and B. 4A includes the involvement of urinary bladder or rectum, and stage 4B is the distant spread of cervical cancer. At what age does cervical cancer start? So cervical cancer is basically a disease of 40s. Generally, it starts in females of 40 years of age and beyond, because the most common cause, which is HPV virus infection, takes 10 to 15 years to convert a HPV infection into the disease. So what are the early warning signs of cervical cancer? How can we know that we need to investigate ourselves for cervical cancer? So basically, there are 3 common symptoms which can occur. One, most important, is the post-intercourse bleeding. If somebody has a frequent post-intercourse bleeding, that female should get investigated for cervical cancer. Other symptoms can be intermenstrual bleeding, or frequent foul-smelling discharges per vaginum, or difficulty in passing urine, or heaviness in the lower abdomen. These are some of the commoner symptoms which will lead you to get yourself investigated for cervical cancer. Another commonly asked question is cervical cancer curable? So to answer this question, I would like to discuss stage by stage treatment on it. So if detected in stage 1, surgery forms the important treatment armamentarium of cervical cancer, and stage 1 is completely curable. If detected in stage 2 or stage 3, again chemotherapy and radiation form the treatment modality for stage 2 and 3 cervical cancer, and this is still curable. In stage 4A also, up to some extent, in the early cases, we can cure cervical cancer by chemotherapy and radiation. However, in stage 4B, where there is a distant spread of the disease is still controllable, but it goes beyond the curability intent. Another commonly asked question is cervical cancer preventable? Yes, cervical cancer is preventable in some cases, where we give the vaccines in female, and it starts from the age of 9 years and before the first sexual intercourse. So the vaccine should be given in a period of 2 to 3 doses, depending upon which type of vaccine are you using, and it can be given till the age of 45 years. But maximum benefit is achieved when it is given before the marriageable age. Having said that, it does not demean that screening of cervical cancer should not be done. Even after the proper vaccination, female should be screened after the age of 30 years by pap smear and HPV co-testing every 5 years for cervical cancer screening. Because mind it, if cervical cancer is detected early, it is still curable. So today we have discussed about cervical cancer, that it is the most common cancer in females in India, and if detected early it can be curable. So basically the stage 1 and stage 2 3 cancers are really curable, and up to some extent the stage 4 cancers also. So you should not ignore your symptoms of post intercourse bleeding, intermenstrual bleeding and foul smelling discharges. Get yourself properly investigated if you do have these symptoms. Also, for prevention of cervical cancer, get your children, female children, vaccinated starting from the age of 9 years and before the marriageable age preferably, and get them screened beyond 30 years with the pap smear and HPV core testing. So it is to be kept in mind that it is one of those cancers which has potential for cure if detected in an early stage. So if you find this video useful, please do post your comments and questions and subscribe the channel.